Good afternoon, everyone. This is Sarah Goodwin with the National Center for Healthy Housing. Welcome to our latest webinar put on by the National Safe and Healthy Housing Coalition. We'll be hearing today from the folks at City Health Dashboard. I don't have much of an introduction to give, so without further ado, I'm going to hand it over to Becky to start the presentation.
Great. Can everybody hear me? I will assume so unless we see stuff in the chat box that you can't. So welcome and thanks for joining the webinar today, Exploring City and Neighborhood Measures of Housing and Health Equity. Many thanks to Sarah and Amanda and the National Safe and Healthy Housing Coalition for hosting us. I'm Becky Ofrane, Manager of Engagement and Partnerships with the City Health Dashboard out of NYU School of Medicine's Department of Population Health. I'm joined by our director, Shoshanna Levine, as well as Sammy Breslin, and I think some other members of our team are actually attending virtually. So our goal with the City Health Dashboard, let me make sure we're working here. Okay. Our goal with the City Health Dashboard is to help cities and leaders really leverage the power of local data to improve the health of residents. So today I'll talk about how you can use dashboard data at the city and neighborhood level to help communities improve health and well-being, especially within the context of housing and healthy homes. And before we dive in here, I just wanted to get a sense of what cities and organizations are represented on the phone today. So if you can just enter it right into the chat box, just so that as we go forward with the presentation, we have a sense of the organizations and the cities that are present. Okay, so think of all the different ways that cities impact health. Housing, access to healthy food, walkability, and neighborhood environments. There's plenty of areas that city leaders can implement policies and programs to cause real improvements in day-to-day well-being of residents. And in the world of public health, we know that what gets measured gets done. Dollars tend to follow the data, and if you can show with real numbers where resources are needed or where they're making an impact, decision makers will usually listen. The problem is accessing local data. We heard from city leaders that there's a lack of data at the city and neighborhood level especially. Now, city leaders might know anecdotally or by what residents from one particular neighborhood tell them, but how do you know what's really driving health in the city? Most data on health and the drivers of health are not organized at the city or neighborhood level, but rather at the county, state, or national level. And the City Health Dashboard really changed that for the largest 500 US cities. So the dashboard launched in May of 2018. It's a free website that shows over 35 measures of health, the drivers of health, and health equity for the largest 500 cities in the US. And that includes cities down to a population of 66,000, covering over a quarter of the US population. The tool really allows you to view important health-related measures at the city level and at the neighborhood or census tract level for 2/3 of the measures. Where available, we also provide the data by demographic breakdown, such as gender or race and ethnicity. And the dashboard, it takes health determinants out of the realm of just the health department so that city planners, buildings department, the police department, they can all collaborate together on issues important to them. We democratize the data, highlighting gaps and disparities to ensure that everyone has the same opportunity to live a healthy life. The dashboard is geared primarily towards city leaders, collective impact and cross-sector work groups, and community advocates, but it's also available and rigorous enough for academic researchers, journalists, and students to access. So for you researchers who might be with us today, we'll show you how to access everything on the website, but also by downloading the data or accessing an API when we get into a demo in a few minutes. The dashboard allows you to dig into issues at the neighborhood level, and like here, we see life expectancy in Columbus, Ohio, where across 3 census tracts that are right next to each other, within a distance of less than 2 miles, life expectancy ranges from 60 to 80 to 68 years. You can also look at how your city is doing compared to other peer cities on important health issues and compare apples to apples. So the dashboard was developed by our team at the NYU School of Medicine, Department of Population Health, in close collaboration with NYU Wagner School, the National Resource Network, National League of Cities, and ICMA. And we also worked closely with our pilot city partners to create a really easy-to-use one-stop resource to help create healthier and more equitable communities. We access local data from national data sets, so you can compare across cities, and we update the data regularly. We also work with our partners to select meaningful measures that are actionable at the city level. And for us, that's a crucial piece to really empowering local leaders who know their communities best. We wanted a manageable, curated set of measures balanced across the 5 health domains shown here. And kind of diving into those, here are those different domains with the actual measures listed out. So looking more closely here, you can see we cover kind of the traditional measures of healthcare and behavior like uninsurance rates, smoking and physical inactivity, and health outcomes like breast cancer deaths, diabetes rates, and life expectancy. But we've also focused on socioeconomic factors in the built environment, such as walkability and air pollution, children in poverty, and education measures and crime. And all of these measures together really help to give a fuller picture of well-being in a city. In fact, we can analyze which measures users of the dashboard look at most frequently, and besides life expectancy, obesity, and diabetes, the most popular measures are poverty and income inequality. And so together, these are really issues that contribute to health as much or more than visits to the doctor. So I started some of the measures here that we think would be most relevant to the housing folks, and we'll go a little bit deeper on a few of those measures now. So starting with excessive housing costs, affordable housing availability is a major issue in cities everywhere from New York City to Manhattan, Kansas. And of the current set of 500 cities in the dashboard, 37% of households in these cities on average spend more than 30% of their income on housing costs. And we know that this kind of burden impacts physical and mental health, with people often choosing rent payments over important medications, grocery shopping, and car payments. It's also shown to impact mental health with the stress and depression that come with being afraid of losing your home. Cities in New Jersey surrounding New York City, in California surrounding LA, and in South Florida around Miami have some of the highest housing burdens, reaching almost 60%. And I'll get into some more local and national trends later as well. We have 2 lead metrics I want to describe today, housing with potential lead risk and a lead exposure risk index. The first, housing with potential lead risk, describes the percent of housing stock with the potential for elevated lead risk, factoring in the age of housing. And this is based on ACS housing data as well as research out of HUD, Washington State Department of Health, and Vox Media. The lead exposure risk index takes this a step further and factors in household poverty to generate an index from 1 to 10 for census tracts across the country. And this measure really helps to magnify the neighborhoods where lead exposure could be an issue. Now, to show you how to put these measures into context, I'll pass it to Shoshanna Levine, our program director, to show you a few features of the tool in action.
Thank you so much, Becky. And so it's great to be here on the phone with you guys all today. As I'm going through, if you have questions, you can type them again into the chat box, and I'll try and make sure to answer them as they're coming in through the demo, or we can get to them. We'll have plenty of time for a Q&A at the end if I miss anything. So here is the City Health Dashboard, and it's a free website that anyone can access. All you really need is an internet connection to be able to get access to the data. And so you come to the site and type in the city that you're interested in viewing. And today we can start with Atlanta, and you can see as I'm typing different, the list shortened so I can find what I'm looking for. And when you click on your city, this list of metrics that Becky was just showing pops up on the screen. And so we have those 5 domains and all of the measures broken out into their domain. But perhaps we're not sure where we want to start today. We can click on this overview, which takes you to a page that really is a dashboard overview of all of our measures for the city that you're interested in. So you can see how the city is doing, kind of in a very snapshot view across the 37 measures we have on the site. There's a little bit more about the city and just some basic demographic information at the bottom. But after looking at this, perhaps we're interested in a measure like smoking. And so we can click on that and we can get a little more information on the smoking rates in Atlanta. But if we want to dig deeper, we can click this metric detail button. And that really takes us to the core of the site, which is being able to dig into particular measures and the data for these measures for each city. So I'll start with a little bit of orientation about how information is presented on the site. So there's information about the city at the top of the page. Our navigation bar is this blue bar with the arrows with the different features. And there's some information about the measure up top here. And if I open that, it'll give you information about the source, years of collection, and then some tips and cautions. And we have these metric one-pagers that our team has put together for all of our measures that will give you information on why we think that this measure is important, how we calculated it, some pros and cons of the particular measures that we've chosen. And in this drop-down menu here, you also have the ability to swap between years of data. There was a question about historical data already. And so depending on our measure source, we have historical data for 29 of our measures, and they go back different amounts of years. So for some data sets, it's only 1 or 2 years. This 500 Cities Project data from the CDC, we can get 3 years. For some of our measures, it's all the way back to 2012 for our vital statistics data as well. So again, that really depends on the data set and what is made available to us. But we are committed to updating the data as it becomes available. So as new data is released, we pull it in, analyze it, put it up on the site. So we have a few different releases during the course of the year where we'll add new years of data, and we'll continue to be doing that moving forward. So then we get to what we're all really interested in here today, which is the city value for smoking in Atlanta, Georgia. And this kind of blue scale bar is how we present data across the site. So I'll just spend another second here talking about it. This yellow or gold bar shows you the city or census tract value. This blue triangle is the dashboard city average. And this green check mark on top is present when the city is doing better than the dashboard city average. So the value for smoking in Atlanta is slightly lower than the dashboard city average. And so you can see there that it has that check mark. And then here, this blue check mark in a circle is just kind of another visual signpost, so you can look really quickly at this information and see which direction you might want to move in to improve outcomes. So for something like smoking, a lower number would be better, but for something like high school graduation, a higher number would be better. And so that check mark just switches sides. So then we get to what I think is really the most interesting, or one of the most interesting features of the site, is being able to look at the data for the different census tracts within the city. And about 2/3 of our measures we have broken out by census tract. And you can see that there's a pretty clear pattern here with smoking rates in the city. And you can see that census tracts that are right next to each other have vastly different rates of smoking. And you can click on the different tracts, you can hover over them to get some more information about what's going on in particular neighborhoods. And so from there, you might be thinking about what's driving some of these rates. And that's where, again, I think the City Health Dashboard really provides some fantastic contextual information, because you can pull up a measure like children in poverty. And we know childhood poverty really is not distributed equally across groups, and we also know that it can have some really long-lasting effects across the lifespan. And so we can compare children in poverty to that smoking data, and we can see here that the rate of childhood poverty is actually much higher in Atlanta than our 500 or dashboard city average. And we also see a similar pattern than what we saw earlier, where in the northeast of the city, the rates of child poverty tend to be much higher, and in the southwest it's lower, although the two tracks that I clicked on earlier are actually quite similar. So you can dig around in there and make some comparisons as well. And I'll show you in just a few minutes another way to make some comparisons as well. And we also have the ability to view this data by demographic detail. For about a third of our measures, we're able to break it down into demographics. And again, this depends on the data set that it comes from and how the data is made available. So again, we have a city value for childhood poverty overall, but then if we look down here, we can see it broken down by race, ethnicity, and you can see that there's some serious disparities across racial ethnic groups within the city, where some are doing much better than the 500 city average for that group, some are doing much worse, and same with the comparison to the overall city average. You can also see kind of the impact that it's having on children within the city. So 62.4% of children in Atlanta are Black, and they also have an extremely high rate of childhood poverty compared to some of the other groups within the city. So we also have the ability to compare cities within the dashboard. We heard from when we were developing the site, as Becky said, we work closely with a number of cities and groups that work with cities. And we heard a lot, you know, we always get compared to this one city within our state because the data always comes from the state, but they don't look anything like us. They're much bigger or smaller, or their population is just really different. And we hate the comparison, and we can never really improve compared to them. But we know that we're doing better. So we have the ability to make comparisons in two different ways. So first, if you're from Atlanta and you know that perhaps you want to compare yourself to a city like New Orleans, you can type that in and click on that, and it'll add New Orleans to the drop-down list here, and you can make the comparison between the two cities' data. Or if you're not sure perhaps what a good comparison city is, we have a number of filters that you can choose from. So a city maybe with a similar population size within the same region gives you this list of 8 different cities. And maybe a city like Tampa, Florida is something that might not be immediately a city that you would think of, but becomes a good comparison based on the factors that are important to you. And so you can click there and add that to the list as well. And again, because this data is available by demographic group, we have it broken down here in a table below. And so getting back to some of those comparisons I was making in the beginning, we have a compare metric function that lets you choose 2 measures. And so we can go back to that smoking measure and make the comparison with childhood poverty even easier. So we have 2 ways of looking at this. First is a metric comparison map, where the value for childhood poverty is the blue shaded polygons on the bottom of the map that represent census tracts. And the values for smoking rates in the city are represented by the dots within each of the polygons, the reddish pinkish dots. And so you can see how those measures might move together. And in both cases, the darker color indicates a worse outcome. So lighter colors are better outcomes. And you can see there's a general trend of light with light and darker colors with darker colors. And if you hover over any of these census tracts, you can get the value for the 2 measures as well. But we also have this scatter plot here if you're interested in viewing the correlation here We know correlation does not equal causation, but it can give you a sense of the overall trend within the city. If you click on any of the particular dots, the values within that census tract for both of the measures will come up. And on top of the overall trend, this can give you maybe a sense for some outliers within the city. So maybe a census tract over that has higher rates of childhood poverty, like this one over here, but lower rates of smoking. And you can think about, what might make this area quote unquote positive deviant, that they're kind of bucking the trend that you might expect in that area or within the relationship between those two measures, and think about how to spread some of those successes across different neighborhoods as well. And then one more thing that I would like to show you here, we also have this take action section, and we've recently kind of revised this, where we've heard from a lot of cities, thank you so much for giving us this data. Now we know we're doing really poorly in this area. What do we do now? So we don't want to leave people with that information. We want to give them some of the tools that they need to begin taking action. And so we have a number of different resources here that are all culled from different sources that we've found credible and trustworthy and really experts in these areas. So under programs and policies, you can find a list of programs and policies that will address childhood poverty, which is the measure that we have up here selected within cities. And so these are both policies that you can implement within the city, programs that have shown to be successful, and it's a mix of really research-backed, evidence-backed policies and programs, as well as really some promising practices where we know that there aren't randomized controlled trials for everything that we would want to do in public health. If we waited for that, we would not be able to get a whole lot done. But we know that there are some cities that have begun working in these areas and shown some success. And so we have pulled some really great examples from promising practices as well in order to spread some of those ideas as they're being developed. We also know that just kind of giving you an idea for a program or a policy isn't enough, and have really thought about this idea of how you can do it and how you can really get it done. And so we have a number of different types of resources here around finding partners. So who else should be at the table, and how you can locate them, and how you can bring partners together. Exploring strategies, and this is really a range of different strategies, from communicating science, talking about, there's a lot of communication stuff here talking about social determinants of health, thinking about advocacy and how you become an advocate, and things like that, depending on what you're trying to do and who your audience is. Finding funding, we know that no one ever has funding in public health, and a lot of these other areas as well, so we've tried to pull together some resources there. And finally, measuring impact, how you actually evaluate that you're making a change within the area you're trying to affect here. And so one more thing that I want to show you as well, Becky mentioned earlier that especially for researchers, but really for anyone, we do make all of our underlying data available. And so on this data access page, which you can get to from this menu here, or in the footer on any of the pages as well, we have two different ways to access the data. So the first is through downloadable data files if you're interested in working in Excel or CSV. But we also have an API for those of you who work in APIs and are interested in accessing the data that way. And again, we really want to make sure that this data is available for anyone who wants to use it and accessible to everyone. So yeah, if you have any questions, please type them in, and I would be more than happy to answer them during the Q&A.
Okay, in the meantime, we're just going to finish up with a few more slides here. Okay. So we just want to highlight a few trends nationally and in some cities, starting with Chicago, related to housing. So in Chicago, 40% of households struggle with excessive housing costs, just above the dashboard city average of 37%. And more affluent neighborhoods in the northeastern and far southwest part of the city generally experience lower burdens, where you see the lighter colors here on the map on the right, than neighborhoods in the west and south side of Chicago, which also have higher concentrations of poverty. Housing cost burden is a strong driver for health in Chicago. You know, neighborhoods struggling with higher housing costs also tend to have lower life expectancies and poorer mental health. Research that we did out of our City Health Dashboard team found that of the 500 largest U.S. cities, Chicago is the city with the largest gap between the neighborhoods with the longest and shortest average life expectancies. Residents in a section of the more affluent Streeterville neighborhood can expect to live an average of 90 years, compared to residents in a portion of the Englewood neighborhood who experience an average life expectancy of 59.9 years. And that's shown in the map on the left there. The research also found that cities with greater degrees of residential, racial, and ethnic segregation often had alarming gaps in life expectancy across different neighborhoods. And this trend was seen in Chicago, which has a segregation score of more than 3 times the average score for all 500 cities in the dashboard. Now taking a look at Philadelphia, who, like many cities, is working hard to address local lead exposure. Using the dashboard maps and their own data, the Lead-Free Philly initiative is getting more children tested and connecting lead to other issues like asthma and more visible health issues related to home exposures to drive awareness and action. Similarly, in Louisville, Kentucky, the health department mapped where resident blood tests were above 5 micrograms per liter, along with the housing with potential lead risk measure to help explore health inequities. And by doing this, they discovered pockets of likely undertesting of children's lead levels. They've used this information to increase opportunities for testing and education around lead exposure in these specific neighborhoods. And then looking nationally across the nation's 500 largest cities, as we saw earlier, 37% of households pay more than 30% of their household income on rent. And just focusing on whether cities are above or below the average rate of housing burden, and that's shown by the red and green dots here, we see that coastal regions with big cities tend to have higher than average rates than those in the middle of the country. But we also see in some southeastern cities like Savannah, Georgia, Birmingham, Alabama, and Wilmington, North Carolina, about 40% of residents spend more than 30% of their incomes on housing, despite the fact that these areas are typically perceived as affordable. So when incomes are lower, housing costs consume, a larger proportion of a family's take-home pay, leaving less to spend on medical care, healthy foods, and other necessities, which can lead to poorer health. And in cities across the country, low-income families have seen a much steeper rise in housing costs over time and are paying a greater share of their income on rent than better-off families, in part because the actual rent and housing costs don't differ much for lower and middle-income Americans. So where there are concentrations of poverty, there tend to be higher concentrations of housing cost burden. So what to do with all this new information? Shoshanna showed you a little bit of this, but we don't want to just make data accessible on the dashboard. We want you to be able to take action on it. So we have this Take Action Center really incorporated in, and it features a curated list of policies and programs from partners like County Health Rankings, Change Lab, Local Housing Solutions, and NYU Furman Center. We also feature other resources that help answer questions like how can I fund this program, and how can I monitor and evaluate the effectiveness. We're also happy to add resources here, so if you know of something particularly useful in your work, please send it to us and we'll take a look at adding that. So what's next for the dashboard? Since launching in May of 2018, we're continuing to grow with our user base. We're always looking for new measures that are locally meaningful and actionable and available for most or all of the cities. We're particularly researching and assessing data sets currently on asthma, transportation, and climate change. And if that's work that you're doing, please reach out to us. We'd love to chat about that. Also, where extensive local data is available, we're eager to partner and build out the dashboard with new data sources, incorporating measures and sources seamlessly into the format of the current city pages, like you saw with Atlanta today. We're also expanding soon to smaller cities, which is a huge area of need, as you may know. Large cities typically have staff and data capacity to collect and analyze a lot of this data on their own, but smaller cities and agencies often do not. So we're excited to be adding over 200 cities down to populations of 50,000, and those pages should be up next spring or summer. We can also partner with regional, state, or national organizations that are region or issue focused to create a health dashboard that covers a certain geographic area focus. So we hope this has been enlightening, and we'd love to hear your thoughts and questions. So we'll open it up now for questions in the chat box. And again, our goal today is really to spread the word and make sure that the dashboard is available and top of mind for anyone who could find it useful. Anything to address just yet?
Yeah, we've had a few questions come in. So first, just asking about accessing the recommended programs and partners information for a metric. So that's available in the Take Action section, which can be pulled up in two different ways. So the first is through that menu on the left-hand side of the page there, and so you can get the whole thing there. Or if you're already looking at a city, if you're within a city page, you can. So we'll go back to Jersey City, where Becky is from. But you can find the Take Action button there as well, and that will take you there. So two different ways of accessing the same information. If you're already within the city page, looking at a metric, it'll show you information specific to that metric in city, and you just have to change the metric using that button there to get different information. That kind of main menu, Take Action, will show you information about, or you just have to filter one more time there to get into that as well. And there was another question about whether the data is downloadable. Yes, that is through our data access page, and that is all of the kind of the underlying data that goes into the site.
And when you first go to this page, there's a short form that if you're going to it now and seeing something different, we have just a data access form that we ask people to fill out that just has some basics. But then once you fill that out, based on your cookies settings and things like that, you shouldn't have to do it again, but sometimes it does pop up again. But once you do that, it takes you through to this page where you can access, like Shoshanna said, all the underlying documents for the data, download the full data set for all the cities, or you can just download by state if you only need a particular thing. And this is where you can also access the API and go through that process.
Great, thank you. And there was a question from someone who tuned in a little late but wanted to know if there were environmental health metrics here, such as ambient air quality.
So we do. So if you go to metrics here, let's see, I think that's under physical environment. You can also expand all of them here just to take a look at everything, but we do have air pollution. And this gives you some background on that measure. But let's go ahead and pick, I always pick Jersey City. And we can change the metric here and pull it up that way as well.
Yep, and we have a number of different environmental measures on the site. We know, I think that's one of the domains where we have the fewest measures, though. and always something that we're looking to expand. So if you have thoughts on measures that would be useful, we always love hearing from people. Please send us an email or tweet us, and we'll make sure we'll put up our email information again on the screen, as well as you should hopefully have it from the sign-up information as well. And there was a question about actually a method for taking feedback from cities, and we don't have kind of a formal feedback mechanism other than our email address, but we hear from cities and different users a lot, and we really like that information because we want the site to be useful, we want the data to be useful to our intended audiences, and so we always like hearing from people to hear how we can make it more accessible, more useful, or answer any questions you might have.
Yeah, and we, if, while you're maybe taking a look at the site and thinking about other things, we encourage you to go to the City Health Dashboard page and subscribe to the newsletter down here. We often send, important updates about data releases, site expansions, and new features. So that's a great way to kind of stay in the loop and know when we're updating certain things about the site. We also love featuring stories and case studies from our users. And we do have, you can access that either through the city highlights over on the right side of the bar here, or from the main menu. We have our stories and news here, and sometimes we do information about, detailed dives on our metrics. This month or last month, we were highlighting Austin and how they use the data, and we really love to do that with cities to show other places how certain cities are using data to advance public health. So whether you're new to the dashboard or have been using it for a long time, please reach out to us. We like to kind of keep conversations going with people and kind of answer questions that way.
And we got two questions about particular measures that I'll read them out and kind of combine the answers. So one person is interested to know, as housing and poverty, or as part of housing and poverty, are there measures collected on energy burdens or other utility costs, including water? Wondering because that has a big impact on housing costs. And then there was another question about substandard housing conditions like mold, pest infestation, and code violations. And those are actually all measures that we have considered and would love to include. I think the biggest issue that we've had with those particular measures is really being able to access the data set for all of our cities within the dashboard. I know on substandard housing conditions, the National Housing Survey only has data for, I think maybe about half of our cities. We looked into it when we were first launching the dashboard and ended up not going with that information because we just couldn't get it for all 500 cities within the dashboard. If you have a data set for substandard housing, we would love to include that measure. We do have the LED measure, which looks at age of housing, which can be maybe not excellent, but somewhat of a proxy for housing quality. But we know it doesn't quite get at what we'd like to get at there. But again, that's an issue with being able to access the underlying data sets or a data set for all of our cities. And it's the same thing with energy cost burden. That's something that we've looked into pretty extensively and couldn't find a good data set for cities across the country. Most of that, I think, came from state data or utilities, which were not kind of standardized nationally across the country. And then there's a measure, or another question, when you say housing quality, do you mean paint chip size of field paint? So I'm not quite sure what you mean there, but...
Or if they're responding to the question before me.
Yeah, possibly responding to the other, sorry, the other questioner. So yeah, if you want to put a little bit more information there, we can try and get you an answer there. And then there was a question: do we have vaccination data? Which also is something that is very difficult to get at the national level for all of our cities. And so we tend to, or we pull for all of our measures except for our education data. We pull from national data sets, and the reason for this is really because we have 500 cities within the dashboard and soon over 750 cities, to try and get data from individual cities would just be too much of a burden, both on our staff, but also just on the people within the cities. Often, the reason we're doing this is because we have found that they don't have access to this data at the level of granularity. And so we pull from national level data sets, and for some of the measures that we would like to include, we've had to make this trade-off where we just can't get the data, or we cannot yet get the data that we would like to get there. So we're always looking, though, to add new measures, to improve the measures on our dashboard. So if you have any ideas for how we can do so, please reach out to us. And then, so we have some clarification. What kinds of metrics would be ideal for substandard housing? I've heard number of renovations, whether paint is peeling larger than 8 by 11, etc.
Yeah, that's interesting. We can look into that.
Yeah, I don't think we have necessarily our own ideas about what would be ideal for substandard housing. We often rely on experts like yourselves to help guide us for adding new measures. We're not necessarily experts in everything that we have on the dashboard, and so we know the limits of our expertise and really rely on people within our university as well as other contacts for our team to make sure that we're kind of putting the best information out there, and also consulting with our network of cities to make sure that the measures are meaningful and useful to them. So if you have ideas, please send them our way.
Okay, so any final questions? We are doing a couple of upcoming sort of virtual office hours where we'll do an overview of the dashboard and dive into some focus areas. The next one is coming up next Thursday. And then we have another one in December. And those are really a great opportunity, if you found this interesting and like it would be useful for some other people in your city, your organization, you can all sign up for the office hours and hop on together, get the brief overview, and then really kind of dive into questions and issues that you're dealing with in your city, and we can go through that. They're, meant to be pretty small. So if you find on Twitter or email us, we'll make sure you get the information about that office hours to join us for that. Okay, so if there's no final questions, again, please do reach out to us. We love hearing from people about how you're using the data, answering questions that you have. We are totally accessible. Thank you for your attention today, and we'll see you on the dashboard. I'll hand it back to you, Sarah. Do you have anything to close up with?
Nope, but I wanted to let everyone know that we did record the webinar, and so there'll be a recording available for people to view it again or share it with colleagues and partners after the fact. So you should be seeing that in your inbox within a day, and if not, you can always, people can always email me looking for it specifically. But otherwise, thanks so much, Becky and Shoshanna, for your presentation. I know that I'll be checking out the dashboard more, and I'm sure that others will as well. So thanks, and have a great rest of your day, everybody.
Thank you.